Come on up. Well, welcome again. Excuse me, and thank you very much for coming. We have these press conferences in order to keep the people of South Carolina up to date and well informed on the status of the virus and the status of our efforts to accelerate South Carolina back to our position of prominence and prosperity. And we're taking some more steps today. I want to thank Holly May for signing and Karina Poupard, and thank you very much. And Dr. Linda Bell will answer some questions, make a presentation in a moment. But we're making progress, and we are aware that there are a lot of people out of work, and I'll address restaurants today. And a lot of iconic restaurants have actually gone out of business, and everyone in the state regrets that. And there are a lot of businesses that are having great difficulties, and a lot of people are out of work. Our unemployment claims are in record numbers, but we are doing the best we can with this dangerous virus to get us back into full business mode, full operation, just as quickly as we can. The virus has been chasing us, but now we are turning the tables. We have extensive testing going on, and the sites, some are permanent, some are temporary, some move from day to day, can be found on the various websites, including accelerate.sc.gov, as well as the DHEC website, and they're all linked up together. And we encourage people to look at that, and there's no charge for those tests. And we're getting, at this time, the materials that we need, the equipment we need is coming in at a good rate. So we are extensively beginning to test and also to track those who test positive for the virus, to find out who has tested positive and find out whom they had contact with, and then follow up with them. So we have a very aggressive effort that we've launched, and that is enabling us to take these steps. This is one of the things that enables us to take these steps to accelerate South Carolina's businesses back to where they want to be. So today I'm lifting all remaining restrictions on boating that we imposed on boating on the South Carolina waterways. That includes the beaching of boats on the islands, on the sandbars, on the riverbanks, on rafting. And that means that all the laws and regulations return back to normal, with this exception. The law that is automatically activated, like the price gouging law, is the one that enables any law enforcement officer to arrest, to charge with criminal charge, anyone who is posing a threat to the public health or public safety in groups of down to 3 or more. Could be a crowd of people, 3 in a group, 23, 103. That law is activated and it is still in effect. But boating can get back to normal, but we do ask people, the laws and the rules are back to normal, but social distancing is still recommended, and we urge the people of South Carolina to use common sense. The virus is still here. People are still vulnerable, but we are lifting that restriction. Also, last Friday, I announced phase 1 of our acceleration plan, which was outdoor dining at restaurants. That is, the restaurants could serve the food outdoors. Today, I'm announcing phase 2, and this has been devised, as you have seen, through Accelerate SC, which included recommendations, and they're in written form, and they're available on the websites that I mentioned. And they allow indoor dining up to 50% of the certificate of occupancy issued by the fire marshal on a restaurant. Up to 50%. Still, social distancing is required. Still, of course, that law enforcement measure is still in effect. But these recommendations, these policies, these suggestions are comprehensive They are well thought out. They have been researched. Some have come as best practices from other states. This has been quite a process and includes such things as the sanitation, providing hand sanitizers at the entry doors. Table condiments such as salt, pepper, ketchup, etc. should be removed from the table, provided upon request. The sanitizing solutions are used for tables, chairs, and all of that. Check presenters. Sanitize all doorknobs. Cleaning supplies should be single use. That's paper towels and those kind of things. The tables should be spaced both indoor and outdoor at least 6 to 8 feet apart, depending on the chair placement to keep the diners at least 6 feet apart. No more than 8 customers at a table during this phase 1. All of these things are extensively set out there. They are all good. They've all worked in other locations, and we urge them on the restaurants for their use. Also, now this goes into effect at Monday, the 11th of May at 12:01 a.m. That is early Monday morning, and that's when they'll be it'll be in effect. And then later, upon seeing how that works, getting feedback, and watching the accomplishment of what we hope to do with that, then we'll consider phase 3. On Monday, I will likely address the close physical contact service businesses. That includes such things as the barbershops, hair salons, nail salons, and gyms. Those are the close personal contact that have been discussed by Accelerate SC, and we hope to have a decision made and announced as early as Monday on those. So again, the people are out of work. We understand the hardships that these rules and policies require, but it's all over the country, and not only our country, but all over the world. And we are trying to do the best we can to see that the people of South Carolina suffer as little as possible. And that means that we must get back to work, must get back to this prosperity that has been ours, but we must do so quickly, but we must do so safely. And that is what we're accomplishing today. Dr. Bell?
Governor. Good afternoon. As our nation and state continues to respond to the COVID-19 pandemic, here in South Carolina, we remain committed to protecting the health and safety of all South Carolinians. In order to have the information for all of us to begin a safe return to pre-pandemic lives, South Carolina and the entire country need to drastically increase its per capita testing. The federal government has challenged our country to increase testing in all 50 states, and we in South Carolina accept that challenge, and we have a goal of testing 2% of our population, which is 110,000 South Carolinians per month beginning this month. As we mentioned earlier this week, DHEC has developed a statewide testing plan to dramatically increase COVID-19 testing and making that available around the state to help meet that goal. The testing expansion will also help us to better understand the overall disease activity within our state and will allow us to make well-informed, data-driven decisions as we work to establish normalcy and reactivation of our state's economy. This increased testing will also help us ensure that those who are at highest risk of developing severe complications from the disease get tested. And should they test positive for the disease, that they will receive medical care they need to help them recover. Our plan focuses on 4 key testing areas: universal testing of nursing home residents and staff, expanded testing in under-resourced minority and rural communities, and conducting mass testing in urban areas, and finding new testing sites. Beginning on Monday, we will begin the universal testing of all 40,000 residents and staff in 194 of our state's nursing homes. We're taking a phased approach to this expansion of testing. The testing will begin on Monday at 74 of the 194 facilities, and the majority of those 74 facilities have volunteered to take part of this first round of testing. We hope to have all 3 phases of this plan completed by the end of this month. As we see in the data regularly updated on our COVID-19 webpage, nursing homes and residential care facilities are impacted by this virus because of the close living conditions in these facilities and the fact that the elderly residents of these facilities are more susceptible to complications from the virus. Today's updated data will show that 106 people in these nursing homes and similar congregate facilities have died, and there have been 1,030 positive cases from those facilities. DHEC also will be increasing testing in other congregate facilities such as prisons and jails and group homes. We continue to also focus our testing efforts on reaching minority populations that have been disproportionately impacted by COVID-19 infections. African Americans represent 27% of our state's population, yet account for 44% of confirmed cases and 46% of the deaths from COVID-19. To address that in part, DHEC will be using mobile testing sites, community paramedicine, and community health care and retail partners to increase testing capacity in under-resourced communities. And just this week, we partnered with CARE South Carolina to hold a free mobile testing clinic in Darlington County, where we were able to test 464 residents in a matter of hours in that community. And it's important to know that our urban areas are also of concern because of their size, the population density, and attractions that draw visitors to those communities. DHEC is partnering with the Governor's Office, with the state legislature, the Hospital Association, the South Carolina Hospital Association, local businesses, and others to set up additional mobile testing clinics around the state, as well as pop-up testing events in the Charleston, Columbia, and the Greenville-Spartanburg areas. We want South Carolinians to know that DHEC and its partners are doing everything we can to stop the spread of COVID-19 in our communities. And a key component of this is increasing our testing capacity. For a list of the testing sites and for all other information about COVID-19, please visit the DHEC website at scdhec.gov/COVID-19. Thank you.
Thank you. So when the restaurants will be able to go from, as we started with takeout, and then we opened it up to the drive-through, and now we're opening it up to 50% inside. But this doesn't mean that everyone has to open. It means those that want to can open. It means that limit that restriction has been lifted. But every restaurant owner or every manager will have to make decisions based on their customers, their clientele, their staff, the safety of their staff, the people working, the people visiting. They'll have to make their own decisions based on their experience in their restaurant in the past. Whether they feel comfortable opening up Monday will be up to them. But we are urging the people to follow these guidelines, to use common sense, and to think about the danger that is still posed by the virus. And of course, we're still urging everyone to practice social distancing. Are there any questions? Yes, ma'am.
Governor, this week we saw several instances in outdoor dining of people not social distancing, long lines in front of restaurants. How are you going to make sure that this doesn't continue to happen?
Well, those were reported in the press, and I think that the citizens' reaction, of course, is what we expect. People didn't like that. Everyone is going to be accountable for their own conduct, and that's why we're urging the restaurants to know their clientele, which they do, and understand the dangers that are posed when they open the doors to 50%. A lot of that was outside, which is better than being inside, of course. But we're urging everyone to be careful. And of course, I still must emphasize that in situations where things are out of hand, there is a law enforcement mechanism that is very much in effect that can be used when necessary. Yes, sir. Joe?
How would you define a threat to public health on the close? Can groups of more than 3 gather?
Sure.
But I guess what would lead to
Sure. More than 3. The law you refer to that sets the 3 as the bottom limit was set by the legislature years ago to define the limits of that criminal authority. Could be 3, could be 10, could be 103. But if we're urging people to use the common sense and understand that this is a dangerous disease and it can still be spread by that close physical contact. None of that is changed. And if law enforcement sees a situation where those rules, those considerations, those courtesies, that care is not being taken, then they can step in and disperse the crowd, and if necessary, they can issue citations.
Is there certain behavior that would lead to law enforcement?
Couldn't hear you.
Is there a certain behavior that will lead to law enforcement?
Well, they'll know it. We've got excellent law enforcement. They'll know it when they see it, just like you and I would. Yes, sir.
I have a question for Dr. Bell. I was just wondering, from a medical standpoint, is there concern that this virus will spread in South Carolina by opening up restaurants more, or is the social distancing inside of them enough to keep it flat, the curve?
Well, there is concern that the virus will spread if we don't practice the social distancing measures, wearing masks. We know that the most likely way that it's transmitted is from person to person. So, as the openings are occurring and we see people participating in behaviors that we know put them at risk, if they're in close contact for a significant period of time, which is really a matter of minutes, 5 to 10 minutes with face-to-face contact with someone without wearing a mask, puts you at risk. And you don't know who you're having contact with, if they are having symptoms or if they're actually asymptomatic but potentially spreading. So the answer is that there remains to be a risk as long as we're seeing significant spread of the virus in the community, and we're monitoring that. And we will continue to expand, we'll continue to test and to expand as described. And the more we know about the disease activity in the communities, we'll continue to use that to inform the governor's office about our disease rates. But people can take measures to protect themselves as we open and resume some normal activities. I can't overemphasize the importance of practicing those measures. So regardless of the businesses that are open and activities that are allowed in public, people must continue to practice social distancing, wearing a mask, and good hygiene. Otherwise, they put themselves at risk, and they put the rest of us at risk for ongoing disease transmission in our community.
Dr. Bell?
Over here, yes, ma'am.
So we've been waiting to hear a breakdown of numbers between staff and patients at nursing homes. From what I understand from Wednesday, that we were looking towards getting that information released. And as we move into this universal testing at nursing homes, do we think we'll be soon getting that? If you have a timeline for me.
Dr. Toomey.
Yes, the question is the breakdown between patients and staff in nursing homes. I know the team was working on it. I don't want to say that it's going to be released today because I don't have that as a fact, but it could be out as early as later on this evening. So I know that they have split it out. They are trying to make sure the numbers are accurate, and it's coming.
Can you tell me how often that's going to be updated, especially with this mass testing going on?
I would be guessing on that schedule. Many times we've started off updating things twice a week, but I would not state that as a fact. But we will, if the data is going to be released today, we'll put a footnote on it that how often it will be updated.
Does that feel like it's in line now with other states, with what they're doing? I understand several other states are doing the staff and patient use. Is this part of being in line with that best practice?
I think as we continue to learn, as we continue to see what other states are doing, we are trying to provide more and more information because data is very critical, very important to understand what's going on.
Yes, ma'am.
Dr. Bell, this is a question for you. So will there be any consideration given to patients that are over the age of 65 with testing? Will we try to roll out testing to those elderly populations first, or will they be prioritized at all?
We're not really recommending the prioritization of any particular groups at this time because it's our goal to test as many people as we can. And also a reminder that there can be people over the age of 65 who are healthy and have no underlying chronic conditions, and there can be younger people that do. So on an individual level, we want people to be tested if they're symptomatic, if they've been in contact with someone and they're exhibiting symptoms. But that prioritization is no longer necessary because we have ample supplies to perform testing for as many people in the population as possible. And actually, if I could, I would like to provide a follow-up answer about the availability of the data from nursing homes, as you mentioned, comparing that to other states. So this is actually a special study in South Carolina. There are a few other states who are doing a study to test all nursing homes and all staff. So the volume of data that will come available from that undertaking means that what we're currently doing for the smaller number of facilities that we've tested, we're able to make that information available about twice a week. But once we collect this massive volume of testing information from all of these facilities, it will probably take us a bit longer to compile the reports and break that down and make sure that the information is accurate and that we can provide it at the facility level. So that's just to prepare people to understand that this is a large statewide study, and that's somewhat different from what we've been providing on a facility level basis. And so we want that information to be accurate, and we will make it available as soon as possible.
Yes, ma'am.
Question, Governor, about these in-person graduations that have been announced. At least in the Midlands, there have been school districts that are saying, hey, we're going to have in-person graduation starting in June for high schools. Just want to get your thoughts on if you feel like that's too soon to have in-person. I believe Sumter's the only one that is going to have a virtual graduation ceremony.
I've read and heard of a number that are going to have different types of plans, but from what I know, everyone is planning on having social distancing, and they're all taking great care to see that they're doing it properly and according to all the recommendations. Yes, ma'am.
Governor, what if we begin to see a spike or a surge in cases in South Carolina? Would you roll out the similar regulations that you just lifted, or additional ones, or any
Nothing
plan?
in this virus, nothing is off the table, of course. We're going to do whatever's necessary to keep the people of the state safe as we can, keeping in mind that part of public health is economic health as well as mental health and physical health. But we know that with the increased testing that we're going to be doing, because we're having mobile sites and all over the state, and you can see them on the websites, we're going to have a lot more testing, so the number of positives, of course, will be going up, but so will the number of people tested. But again, we'll do whatever's necessary to keep the people safe. Yes, sir.
Governor, the guidelines that were discussed yesterday during yesterday's Accelerate SC Response Committee, they've got some suggestions, but those are ultimately adopted for those types of businesses. How do you envision those being enforced by the state? Or would the state actually enforce those guidelines?
Well, it depends. As we're doing here, these are not laws; these are recommendations, and we're taking this step in lifting the 50%, opening up the 50% inside, based on the presumption and the hope that people will follow these recommendations. Now, there are a lot of them in here, and if they follow them, then things should go very smoothly. But if situations arise where the customers or the staff or the business owners themselves see dangerous conduct taking place, then we expect them to say so and do something about it. If as some businesses have done recently, when things got out of hand, they closed the business early. You may have read about that. We expect those kind of things to happen. We expect the people to use common sense to protect their customers, protect their staff, protect themselves, and we expect the customers and staff to do the same thing. But if in those instances where someone is out of control, of course, the police can always step in, as I described earlier. Yes, ma'am.
Governor, Virginia is reopening their salons on May 15th, and they obviously have a much more strict stay-at-home order. So why wait? Why open indoor dining and not some of these hair salons and nail salons?
Well, the hair salons and nail salons are of particular concern because of the close nature of those services. And we moved into this in a very deliberate, gradual fashion. We went in a lot, not nearly as deep and restrictive as other states did, including Virginia. So we're able to come out easier, and we think with less disruption and more safety than the others went in. But every state has to make their own decision based on their own people and the type of situation, the type of compliance that they're having. We've had good compliance, and we know that we have good testing, we have good tracking that is in place, and we expect to be able to measure what we're doing and to respond appropriately. Yes, sir.
My question is for Dr. Bell. Dr. Bell, you mentioned 2% as a testing goal. Compared to other states, South Carolina actually lags behind in testing. Do you think 2% is enough of an accurate base to be making decisions like reopening restaurants, that kind of thing, with that number of testing?
Well, the 2% goal is just one achievement that helps with in comparing us to other states, because other states are using that. But there are other parameters that we're looking at. To be taken into consideration is the testing volume based on disease activity. So when we look at other states that were actually much more harder hit by disease, they were testing far more people because there were so many more people sick. You also look at the availability of resources, so that the 2% is to help with comparison to other states, but we're also looking at other measures. The total testing volume, the percent positive is very important, and looking at by county, and when we've conducted a gap analysis, looking at gaps of where testing is not adequately being offered, we'll continue to look at those measures and make sure that we are getting the testing available where we have determined that it needs to be to serve underserved communities where testing has not been performed. So it's only one of many measures to help us measure our success and make sure that we have surveillance systems in place to adequately detect cases and respond to any potential changes in disease activity.
So 2% is enough to make these, to look at the data and make the decisions to reopen? Is that?
Well, no, it's only one measure. So the 2% helps with comparison to other states that are using that same 2% of their population. But we have other means to look at actual disease activity. That 2% is cumulative cases. What we want to know is in real-time data what's happening within communities. So we'll actually be looking at positivity rates within communities that are current and other measures to make sure that we are adequately detecting cases. So the 2% of the population alone is not the only measure for us to decide if we're adequately detecting new cases.
Yes, ma'am.
Yes, Dr. Bell, a question about the 2% measure by June, because I know that DHEC said that they wanted to test 2% of the population by June. After June, is it another 2% that will be tested in the next month, or how are you trying to work that?
Well, when you think of 2% of the starting population and then you actually have to start subtracting out the number of people who have already been tested, it will be a sort of a rolling measure, and we will look at how useful that information is in terms of if you've tested this percent of the population, what does it really mean? And ultimately, is that really a good measure of detecting disease surveillance? So I think we'll continue to look at that. But at this time, it would be a rolling measure of 2% of the remaining existing population that has not yet been tested.
Yes, ma'am.
Dr. Bell, we've heard about some alerts being sent out by DHEC saying there's a surge of cases in Richland County. How do people sign up for these alerts, and how are you guys sending those?
I'm not sure so I know that we're sending notifications to providers about what kind of testing we want them to perform. I'm actually not aware of alerts going out to communities about disease activity in their communities. I'm not aware of that.
Are you guys sending them to healthcare providers maybe in that area saying there's a surge of cases, or?
Well, no, what I'm saying is that we send alerts out to healthcare providers advising them of guidance. practices that we want them to follow. We make them aware of recommendations for testing. So our communications with providers is the alert system that I'm aware of. We call it our Health Alert Network. I'm not aware of alerts that DHEC is sending to members of the community.
Ms. Adcock.
Dr. Bell, the University of Washington projections for COVID deaths has increased fairly substantially in the last week to 1,100 as of August. Why is that? Is that because of the social or the opening, or is that because of something else?
You mean the University of Washington study of our South Carolina data, or just because they're doing that for all states?
The data that they have that's released on the DHEC website.
So it is based on actual reports of deaths. So when they adjust that model, it is it's a projection of sorts. So when we collect more information about the actual deaths, then that model moves.
2 more questions.
Dr. Bell?
Ms. Adcock, I couldn't see you because of the camera. Do you have another question?
Yes, actually. So you said that phase 3 for restaurants will depend on what happens for phase 2. What might phase 3 look like? Will that be back to 100% capacity?
Possibly. It depends on the data that comes in from the testing as well as the compliance. Yes. Yes, ma'am.
Have you told hair and nail salon owners what they can expect if they are given a notice to maybe reopen on Monday? Any idea if there's been communication with them about what they need to be doing?
What I'm hoping to do is to be able to make an announcement on Monday as to when we will lift those restrictions. I don't think that they'll be lifted on Monday, but we hope to do it as soon as we can. But some of that depends on the data that is coming in on a daily basis. But those just as we have these guidelines, there are other guidelines that are, I believe, have just recently been completed that we will, from the Accelerate SC group, that we will analyze and look and help us make our decision. Joe?
Dr. Bell, just to follow up on the reopening of restaurants, is there any data points that tell you that we should be comfortable with reopening restaurants at 50% capacity?
Data relative to restaurants?
Yeah, or like data and case counts that say, yes, it's okay to open up restaurants at 50% capacity.
Well, the data that we're monitoring applies to the community and the state as a whole. So it is, it's nothing specific to restaurants. It's nothing specific to any type of gathering. If I understand your question, we will continue to recommend the social distancing regardless of if you're in a restaurant or if you're participating in some group activity. You might want to ask your question again. I think I'm not following you.
White House guidelines say we need a 2-week decline in number of cases for us to start lifting social distancing requirements. I guess, what are you seeing that says some of these moves that we're seeing today are okay?
Oh, well, as the governor said, we're following the data and taking a measured approach to reopenings. What our data is showing us currently is that we've seen a flattening of the curve for a relatively short period of time, and we're hopeful that that flattening will remain, and that it will remain to be, that it will, as we increase testing, that the proportion of people that we identify who are positive will still be representative of no increase in disease activity. So in other words, as we markedly increase the testing volume, we're going to see more positive cases. But the proportion of the positives out of the total that we're testing, we can still determine if that represents a relative flattening of that curve.
The percentage of tests coming back positive should either stay flat or go down, which you're hoping to see, correct?
As the percentage positive goes down, that tells us that we are more adequately sampling in the population because we're not just testing the sickest people.